Hey everyone, and welcome back for another deep dive. Today we're going to be talking about something super relevant for all you UPSC aspirants out there.
Oh, yeah.
The Supreme Court just made a huge decision on domicile quotas for postgraduate medical admissions.
It's big.
It could totally reshape India's healthcare landscape. So
Dude, buckle up.
get ready. It's going to be a wild ride.
Absolutely. This judgment from the Dr. Tanvi Behl versus Shrey Goyal case is sparking a lot of debate
For sure.
about how we balance meritocracy with the healthcare needs of different regions. And honestly,
Yeah.
for anyone prepping for the UPSC, this is a case you really need to understand inside and out.
Okay, so let's set the scene here. The Supreme Court basically struck down these domicile-based reservations
Right.
for post-grad medical seats. Now, a lot of states have been using these quotas
Mm-hmm.
to make sure they have enough specialist doctors,
Makes sense.
especially in areas where there aren't enough, and they're investing tons of money in medical education,
Right.
hoping that they'll see those benefits for their own people in their state. It's a pretty logical approach, right?
Yeah, I mean, from the state's point of view, it's totally logical. They're putting money into building these medical colleges, training all these doctors, and they want to guarantee that all that investment actually helps the people living in that state.
Right, and domicile quotas were like that guarantee, but now the Supreme Court is like, nope.
Yeah.
And it's bringing up some big questions, like, is this move to a purely merit-based system
Mm-hmm.
really going to help public health, especially with the huge healthcare disparities we see all over India?
That's the million-dollar question, and a lot of people are saying this judgment doesn't really look at the reality of healthcare in India.
How so?
Well, for one thing, it leans really heavily on this older case, Pradeep Jain versus Union of India,
Okay.
which was all about undergrad admissions.
Right.
But post-grad specialization, that's a whole different ballgame. You need years of extra training,
Sure.
and states need to be able to plan for that.
It does seem like the court might be trying to use this one-size-fits-all approach
Yeah.
for something that's way more complicated.
Yeah, definitely.
And then there's the argument that getting rid of these quotas is going to create a more level playing field, so only the best of the best
Right.
get into these special programs. What about that?
Well, that assumes that the NEET PG exam, the one they use for admissions, is this perfect measure of merit.
Okay.
And that's where things get a little,
Murky.
murky. We've seen times where the exam itself has given us some weird results.
Like what?
Remember back in 2023, the National Medical Commission actually had to lower the qualifying percentile for NEET PG all the way to 0
Wow.
just to fill the empty seats.
Oh, wow.
So that makes you wonder, is the exam really fair and consistent enough to be the only thing we look at when we're talking about merit?
So if the tool we're using to measure merit is messed up,
Yeah.
can we really say that ditching domicile quotas is automatically going to make things more merit-based?
Right. It feels like we might be missing the bigger picture here.
Exactly. You're totally right. The Supreme Court seems to be forgetting something really important. Merit doesn't just exist on its own.
No.
Shaped by so many things, socioeconomic background, access to good education, even where you live geographically.
All of that.
And the Supreme Court has even said this before in cases like Jagdish Saran versus Union of India and Neil Aurelio Nunes versus Union of India.
They acknowledged it for sure.
They agreed that those factors play a part in how we think about merit.
Right.
So are we setting up a system where only the people who have access to the best resources can actually succeed because we're ignoring all these inequalities and just looking at test scores?
It's a valid concern.
It doesn't feel very fair.
Yeah, the judgment as it stands now doesn't seem to take into account those disadvantages that students from marginalized communities face,
Yeah.
or students from regions that don't have access to good coaching or resources.
Right.
These students could be amazing doctors, but the system might not give them a real shot to show what they can do.
It's like we're saying that a student from a small village who had to overcome a ton of obstacles just to even apply to post-grad medical school should be judged only on how they do on one exam.
Yeah.
An exam that doesn't even really capture their talent or their passion to serve their community.
That's a powerful way to put it.
And this brings up another huge point.
What's that?
How is this judgment going to affect regional healthcare systems, especially in areas that are already struggling to find and keep qualified doctors?
Ooh, that's a big one. And that's what we'll be talking about in the next part of our depth dive.
We will, but before we move on, is there anything you think our UPSC listeners should really take away from this part of our discussion?
Definitely. First off, you got to understand the history of these domicile quotas.
Right.
They were put in place to fix the imbalances in healthcare access between different regions, to make sure that states that invested in medical education would actually see those benefits for their own people.
Right.
Second, the Supreme Court's decision, while it's all about merit, it does raise concerns about whether it's overlooking systemic inequalities and whether it could actually make healthcare disparities worse.
Great points. And finally, guys, this isn't just about medical admissions.
No, it's not.
This is a bigger conversation about federalism, states' rights, and the best way to make sure every single person in India has access to good health care.
Exactly. This debate is far from over, and if you're serious about shaping India's future, you need to understand what's at stake here.
We'll be back with part 2, where we'll explore those potential consequences of this judgment.
We will.
And dive into some alternative ways to approach this complex issue. So
Don't go anywhere.
make sure to hit that like button, subscribe to the channel, and leave us a comment if you have any questions or thoughts you want to share. And of course, for more on this, check out the original article in The Hindu.
It's a good read.
We'll be back soon. Welcome back to our deep dive into domicile quotas and the future of medical education in India. We've been talking about the Supreme Court's decision and what it could mean, especially for those of you out there who are aiming for the UPSC. Now, let's think about the possible consequences of this judgment, specifically for those regional healthcare systems.
Yeah, that's a really important area to look at the worry, is that if we get rid of these domicile quotas, we're just going to make the healthcare gap between states even bigger.
Right.
Remember, the whole idea behind those quotas was to encourage doctors to stay and work in the regions where they got their training, especially in those underserved areas.
It's like you're trying to water a whole garden with just one sprinkler.
Exactly.
Some parts are going to be lush and green, while others are just bone dry.
Right.
We can't ignore the fact that different states have different needs and resources when it comes to healthcare.
And that's where competitive federalism comes in the Supreme Court's decision. While it's trying to set one standard for everyone, it might actually be taking away the power of states to create healthcare policies that make sense for their specific situation.
So we're moving away from a system that recognizes that different states have unique challenges and towards a more centralized model.
Right.
But is that really the best way to deal with India's diverse healthcare needs?
That's what everyone's debating right now. Critics are saying that a one-size-fits-all approach just won't work in a country as huge and diverse as India.
I see.
Look at a state like Tamil Nadu, for example. They've been praised for their strong public healthcare system.
Yeah.
And they've done really well with a model where domicile quotas are linked to mandatory service in public institutions.
Oh yeah, the Tamil Nadu model. I've heard good things about that. It sounds like they figured out a way to balance merit with the needs of different regions. Tell me more about how it works.
So it's pretty innovative. Basically, medical students who get those domicile quotas are required to work in public healthcare institutions within the state
Okay.
for a certain amount of time after they finish their training.
So the state invests in your education and you give back by serving the community.
Exactly. It's a win-win. The state gets the doctors it needs, and people who want to be doctors get great training and a chance to serve their home state.
And it seems like the Tamil Nadu model has actually shown results, right?
Oh, yeah. Studies have shown that their domicile quota policy is linked to better health outcomes in the state.
That's a really strong example. It proves that it's totally possible to create a system that promotes meritocracy and takes care of regional healthcare disparities. At the same time, have other states tried anything similar?
Yeah, for sure. A bunch of states have used different versions of this service bond model in the past.
Yeah.
Some states have focused on getting doctors to specialize in areas where they're really needed, like pediatrics or gynecology. Others have tied the service bond to a specific location, requiring doctors to work in certain underserved areas. But the main point is that these models understand that states need the flexibility to create solutions that fit their own unique problems.
Like each state gets its own toolkit with different tools to fix their healthcare issues.
Exactly.
What about the argument that if we get rid of domicile quotas, we'll attract the best and brightest from all over the country and everyone will benefit from that?
That's a fair point. But we have to think about the potential downsides, too. Attracting top talent is great, but we can't ignore the risk of creating a brain drain from certain regions.
You mean like all the best doctors might end up in more developed states or big cities, leaving rural and underserved areas even worse off?
Exactly. We could end up with a situation where all the healthcare resources and expertise are concentrated in a few parts of the country, while other regions struggle to find qualified doctors.
So it creates a kind of healthcare divide, where your access to quality care depends on where you live.
Exactly. And that's why a lot of people say that while merit is important, it shouldn't be the only thing we look at when deciding who gets medical seats. We need a system that understands how healthcare access, regional development, and social equity are all connected.
It's like trying to solve a puzzle by just looking at one piece. You need to see how all the pieces fit together to get the full picture.
Exactly. And that's what we'll be exploring in the final part of our deep dive. How do we move forward? What solutions are out there that can help us balance merit with the need for doctors in every region? Stay tuned, because this is where things get really interesting.
I can't wait. This has been such a fascinating discussion full of insights that are so important for our UPSC aspirants out there. Before we move on to the final part, are there any key takeaways you want to highlight from this section?
Definitely, we've seen that removing domicile quotas could have some unexpected consequences, and it might actually make the healthcare gap between states even wider. The Tamil Nadu model, on the other hand, is a great example of how states can get creative and design systems that address both merit and regional needs.
Those are great points. And remember, everyone understanding these details of healthcare policy is crucial for anyone who wants to work in the civil services.
Absolutely.
You're going to be the ones shaping these policies in the future. So get involved in these discussions, think critically, and come up with solutions that truly serve the needs of all Indians.
Well said. And for those of you who are really following this case closely, don't forget to check out the full article in The Hindu. We've got the link in the show notes.
Perfect. We'll be back soon with the last part of our deep dive, where we'll talk about potential solutions and the way forward. Don't forget to like, subscribe, and leave your thoughts in the comments. We love hearing from you. All right, we're back for the final part of our deep dive. We've talked about the Supreme Court's judgment on domicile quotas and what it could mean for regional health care. Now, this is where things get really interesting for our UPSC aspirants. Let's talk solutions if we agree that just focusing on merit might not be the answer. What are some other ways to make sure everyone in India, no matter where they live, can get good health care?
That's the big question, isn't it? We're not saying merit doesn't matter at all.
Right.
It's more about understanding that merit comes in different forms.
Okay.
Someone who aces a standardized test might be super smart.
Yeah.
But so is a doctor who can connect with the rural community, really understand their needs, and provide care that respects their culture. How do we create a system that values both?
So it's about recognizing that talent and dedication can look different in different people.
Yeah.
So besides changing the NEET PG exam, are there any big changes we could make to how we admit students to medical school?
For sure. Imagine if along with the exam, we also had a way to assess how committed a candidate is to serving underserved communities.
Interesting.
We could look at their volunteer work, their knowledge of public health challenges, even how well they speak the local language if they're applying to a region with a specific language need.
So it's like a more well-rounded selection process, not just about grades. It's like applying for a job. You need the right qualifications, but you also need the right attitude and a passion for serving others.
Exactly. And that change in how we think about things is so important. We need to stop seeing medical education as just a path to personal success.
Yeah.
And start emphasizing its role in building a better nation.
Okay.
Those who choose to serve in underserved areas shouldn't be seen as making a sacrifice. They should be celebrated as pioneers, as heroes who are making our country stronger.
It's about creating a culture of service, where working in rural or remote areas is something to be proud of. It shows a doctor's dedication to their fellow citizens, and of course, this shift needs to come with real support. We've talked about service bonds, but what else can we do to make these career paths more appealing?
Well, money always helps.
Yeah.
We could offer higher salaries for doctors who work in remote areas, provide housing assistance, maybe even have loan forgiveness programs for those who commit to working there for a certain number of years.
Those are great ideas. It's about making the choice to serve not just feel good, but also make sense financially. But it's not all about the money, right? We need to think about quality of life, too.
Absolutely. Doctors working in these areas need access to good schools for their kids, opportunities to keep learning and improve their skills, and a support system that makes their lives easier. We need to make these positions desirable, not just because it's the right thing to do, but because they offer a fulfilling life.
So it's about creating an environment where these doctors feel valued and supported, recognizing that they're not just filling a gap, but they're actually a vital part of making our healthcare system stronger.
Exactly. And this is where technology can play a huge role. Telemedicine, for instance, has the power to completely change how we deliver healthcare in remote areas.
How so?
We can connect specialists in cities with patients in faraway villages, so even people who are miles from a big hospital can still get quality care.
That's amazing. It's like making the distance between a doctor and a patient disappear no matter where they are. And it's not just about technology, it's also about giving local communities more control.
You're right. We need to invest in training community health workers, giving them the skills and tools they need to provide basic health care at the local level. This not only makes healthcare more accessible, but
Sure.
it also helps communities feel like they're part of the solution.
It's about building a healthcare system that works from the ground up, not just from the top down, where communities have a say in how their health is managed. That's a powerful idea.
It is, and it requires a shift in perspective. We need to stop thinking of healthcare as just a technical field and start recognizing its social and cultural aspects. We need doctors who are not only skilled, but also compassionate, good communicators and advocates for their patients.
This has been an incredible conversation, so much to think about, especially for our UPSC aspirants who are listening. Any final thoughts you'd like to leave them with?
I'd say this, the Supreme Court's judgment is important, but it's only one part of the story of healthcare in India. Your generation, the future policymakers, you have the power to write the next chapter. Embrace that challenge, think critically, question everything, and come up with creative solutions that make healthcare a right for everyone, not just a privilege for some.
So well said. And remember, you don't have to wait to be in a position of power to make difference. Start engaging with these issues. Now read research, talk about it, and be the change you want to see. And of course, if you want to dig deeper into this case and the debate surrounding it, check out the original article in The Hindu. We've got the link in the show notes.
It's a great resource.
Thank you so much for joining us for this deep dive. We hope you learned a lot and enjoyed the conversation. Don't forget to like, subscribe, and leave your thoughts in the comments. We love hearing from you. Until next time, keep learning and keep exploring.